Hi everyone. Today I am giving you explanation on the topic diagnostic drugs used by an optometrist. In this video, those drugs are discussed which an optometrist use for the diagnosis of any eye condition or any eye diseases. Types of drugs. We have three types of drugs: mydretics, cycloplegics, and myotics, which are used for the diagnosis of any eye condition. Next one, first of all, we will know the mechanism of that drugs. In case of mechanism, as we all know, this black dot in this eye is the pupil. Okay, so this pupil get dilates. To dilate this pupil, we will examine the inner parts. For example, our retina, which is the last or the inner wall of the eye. So we can discuss it when this pupil get dilated, because when this pupil get dilated, this pupillary area get widens, and when we passes our light or ios light inside it, then a wide beam of light is looking through, so that we can examine the peripheral retina also. But if we don't dilate the pupil, then we are not supposed to look at the peripheral retina. We are supposed to do at the center retina or examine the center retina. So in this way, it is very important to dilate the patient if we are supposed to check the inner parts. Okay, for fundus examination, for looking the cup disc ratio, dilatation is very important. And if the person is suffering from any systemic disease, for example diabetes, heart disease, then we are supposed to examine the retina also of that patient. In this way, the dilatation is important, and for doing the dilatation, these all three drugs are used. Any three out of any one we can use for the patient according to what we have to do. Okay, now let's move to the mydretics. Now all these different drugs, mydretics, myotics and cycloplegics, have different uses. So first of all, we'll study about the mydretics. Mydretics are the types of drops that can dilate the pupil of the eye. The mechanism of all these two drugs is to dilate the pupil. So same here, it is used to dilate the pupil, which means widens the pupil. Topical mydretics are used during eye examination. These are using during eye examination so that they can allow us the visualization of the retina, which I have said earlier that we are supposed to look at the peripheral retina. Is there any abnormality seen or not? Okay, and other eye structures deep within the eye, and some other structures, for example, are foveal point. All these things we can look after the dilatation. Sometimes they may treat inflammatory conditions of the eye. Sometimes inflammation is there, so mydretics are used to treat it. Next one is cycloplegics. Cycloplegics drugs are again used for the pupil dilatation. Cycloplegic paralyzes the iris sphincter muscles and inhibit accommodation. Now, the word accommodation means when we focus any object, when we do focus on an object and then the image forms clear, this is known as accommodation, the ability of our eyelids to adjust its focal length, okay, so that we will look clear, is the accommodation. Now cycloplegics paralyze the iris sphincter muscle. This one is the iris sphincter muscles. Okay, as we all know that the brown part which is showing here is the iris, and the blackish part which is inside, that is the pupil. Okay, now the iris sphincter muscles get relaxed here. Okay, iris sphincter muscles get relaxed while putting the cycloplegic drops. They get paralyzed, okay, so that they cannot perform any kind of function, and in this way accommodation get inhibit, so that we can find out the proper refractive error in case of the patient. Okay, because as we all know, all the plus patients, those patients which have plus power, they accommodate very much, so in this way their accommodation get relaxed by putting the cycloplegic, so that we will give the perfect corrective error, refractive error. Next one is myotics. Myotics are the types of agent that work by the contraction of ciliary muscle. Now in this case the ciliary muscles get contract. It performs the function of contraction. Okay, these are the ciliary muscles. This which you can see are the ciliary muscles. Okay, so these drops perform the function of uh, ciliary muscles contraction. These are used to treat the elevated intraocular pressure. If intraocular pressure is increased, then this is used to normalize it. And various types of glaucoma. It is also used to treat the various kinds of glaucoma. These tightens the tabular meshwork. Now, in case of glaucoma, glaucoma is a kind of disease in which our peripheral vision gets lower and lower, and at the last stage only central vision is there. Okay, this causes when the angle between the cornea as well as the iris is not normal. Okay, so if we put the myotics, then the angle between the cornea and the iris becomes normal. Okay, and the liquids, that is the tabular meshwork, all this material allow the aqueous flow through the traditional pathways. So in this way it is used to normalize that. This was the ciliary muscles, so it helps in the contraction of the ciliary muscle. Rest of the two drops are used to widen the pupil. Thanks for your patience listening. This was the end of topic.